we are fighting an invisible war right now. And it seems like Omicron is winning. It's overwhelming our capacity to provide optimal care for our patients.
Hospitals in Quebec are seeing record numbers of beds occupied by COVID-19 patients, Omicron doubling the amount of hospitalizations in the last week, and ICU numbers are up by 50%, fatalities increasing by 155%. On Thursday, Quebec was on the brink of 2,000 COVID hospitalizations as the government's Healthcare Research Institute announced it'll only get worse before it gets better.
In the next 2 weeks, that hospitalization should reach up to 3,000 hospitalization and 400 people at the intensive care for what we call mid-January. So we are working to have additional staff.
The goal is to reopen 1,000 additional beds for COVID patients by hiring more personnel, as Dube says the health system is missing about 20,000 workers who have been infected or exposed to the disease. COVID unit nurse Naveed Hussein is one of them.
I caught Omicron after being vaccinated twice, after having COVID during the first wave. I still caught it. It caused me to be off for almost 10 days now, and it affects staffing quite a bit to lose a nurse.
This is going to cause, again, massive disruption to everything else we need to do. All of these people who have these semi-elective and elective procedures that are still important and need to get done are going to be bumped yet again.
Unvaccinated people represent about 10% of Quebec adults, but account for about 50% of COVID-19 ICU patients, which is why the government imposed new restrictions starting January 18th. Only those with proof of vaccination will be able to enter the SAQ and the SQDC.
Non-vaccinated people, if you don't get vaccinated, stay home.
Yes, it is one more application of the vaccine passport, but unless there was some evidence of which I'm unaware that there was massive transmission within these stores leading to huge numbers of cases, I doubt highly that's going to have a large impact.
The government says they hope not being able to shop at the liquor store or pot shop in person will be an incentive for the unvaccinated, and more restrictions could be coming.
We are in communication in the coming days with all non-essential service, shopping malls, name it.
Carrot and stick, I don't think that works right now because people will just get more entrenched in their beliefs.
Naveed hopes for better planning from the government so he and his colleagues can continue treating patients adequately.
Our healthcare system is already so fragile, and taking this onslaught right now is not easy at all.
In Montreal, Alyssia Rubertucci, City News.